Hi, this is Curtis Alexander. In this video, we're going to be talking about the side effects that you can get from metformin. And I wanted to do this video partly because some of the other videos that I see out there about the side effects, I think are missing a few things and a couple of pointers in there that I think can be helpful. So let's hop right into it. First of all, it's important if you want to understand what side effects you could possibly be looking at, it helps to understand what metformin's doing in your body. And one of those things is it's going to decrease the amount of sugar that your liver produces, so that will bring sugar down. It also is going to decrease your absorption of glucose in your intestines, and then it improves the insulin sensitivity overall in your body, so you're going to uptake more glucose. All those things can be good things to a certain extent, but they can also lead to issues as well. So I would basically classify metformin as a medication that's going to have two buckets of side effects. One that are more common and I would say less serious. All side effects can be serious, but the more common ones tend to be just more bothersome side effects. And then we have more rare side effects, and the rare ones can actually be really serious with metformin. So I'm going to start with the more common ones, and by a huge margin, stomach upset, gastrointestinal, GI upset is by far metformin's biggest side effect. In fact, in the immediate release formulation, metformin comes in an immediate release and an extended release. Most people do the IR, the immediate release. We can see diarrhea incidence upwards of 53%, which is huge. We'll talk about ways we can avoid that moving forward. And so I guess the biggest thing as far as how to avoid it, you want to start with the lowest dose possible. It's 500 milligrams. Usually you can start with that once a day, and then they will move you up from there depending on how you're responding. But as you move up, so start low, go very slow. That's one of the best ways to avoid it. Another way is keep an eye out for a couple of drugs, verapamil, which is usually used for blood pressure, and then PPIs are your proton pump inhibitors like Prilosec that can cause some of these issues as well. So again, diarrhea is going to be a big one. Nausea and vomiting, up to 26% of people, again, in the immediate release formulation. Some people can get gas, 12%. Then we have weakness. Now, weakness is a pretty broad complaint, obviously, and it can be indicative of a couple of different things going on. I'll talk about that in a second. Now let's hop into the more rare side effects, okay? There's two big ones. I'm going to start with the B12 deficiency because I've already done an entire video just directed at B12 deficiency from metformin. So I'll put a link to that in the description. Go watch that if that's something you're worried about. But the biggest thing is there's some things you can do to minimize your chances of that happening. B12 supplementation is the last one I would recommend. There's other things you could and should be doing first to prevent this, but it can happen, so something to watch out for. And then we have lactic acidosis. Because of how metformin acts, basically they're in your mitochondria. Your mitochondria are like the engines, like a car has an engine, mitochondria are the engine of your cells. And it basically disrupts the electron transport chain and leads to downstream issues, one of which is you can get a buildup of lactate, which is not a good thing. And you will see that buildup of lactate sometimes in people who go on very low carbohydrate diets because their stress hormones are directing their body to not produce as much carbon dioxide. So as a byproduct, they produce more lactate. Again, because of how we're dealing with sugar in the body with metformin, it does put you at increased risk. There are things you can do to prevent that or minimize your chances. And I'll get into those. I do want to point out with lactic acidosis, it can happen when you start and it can happen well into your therapy with metformin. So there's not a great way to predict it. You do want to pay attention to how you're feeling. The weakness that we talked about, that can be related, the weakness can be related to that and B12 deficiency. So do pay attention to how you're feeling. If you're feeling off, don't be afraid to ask for a blood test from your doctor to measure your lactate levels. Okay. Now, there are certain things when you take metformin that are going to put you at higher risk for side effects. The two top ones, do you have liver disease and do you have kidney disease? Okay, because liver disease is going to put you at a higher risk for lactic acidosis. Same with kidney disease, so we want to be very careful with those. Want to adjust dose. We may not even want you taking it. Have you had a recent MI, myocardial infarction, or heart attack? If you have, that will put you at higher risk. Obviously, metformin allergy, that's kind of a no-brainer, but I had to throw that in there. The other one is, do you drink alcohol? I'm not talking about a glass of wine at night, but you have to be honest with yourself. If you're a heavier drinker, that could lead to problems down the road, particularly with metformin. You are going to have to change that habit, or it's going to put you at much higher risk to develop, particularly the lactic acidosis and the B12. And then grapefruit juice. I've saw some videos that suggest grapefruit juice as a risk factor. I think the jury's still out on that. I'm not quite ready to go down that road fully. There's some evidence that's conflicting at times, but it is important for you to know that. The other videos also talked about certain drugs that interact. I think I don't agree with that advice because everybody's different. And what I would do is, if you're thinking about metformin, call your pharmacy, have them run a drug interaction check specifically for you, because when you start adding in more than 2 or 3 drugs to your regimen, the risk of side effects goes up. It gets very confusing. It has to be done individualized. Don't base it off just one video that throws out 4 medications that are super serious, those sorts of things. So like I said, metformin, very widely used drug, can be very helpful for people for a number of different conditions, usually diabetes, but because of how it acts in your body, it causes side effects. Some are more common, which we talked about, and there's also some very serious ones, which you're going to have to keep an eye out for. So I hope the video was helpful. As always, like and subscribe, and I will see you in the next one. Thank you.